Live every moment. Love every day. I wish you good morning with love, happiness, success, health, and peace. Accidents happen anytime, anywhere, without any warning. They usually happen due to carelessness. To avoid accidents, we must follow safety rules. You have already learned about safety rules in previous classes. In this chapter 29, Safety and First Aid, you will learn what we should do in case of accidents. Whenever an accident happens, the injured person must be given medical aid before the doctor's arrival or before the victim is hospitalized. This immediate help given to an injured person is called first aid. It is very essential and saves the life of the injured person. The main aims of the first aid are to give some relief from pain due to injury, to prevent the injury from getting worse, especially if there is a bleeding. And the last aim of the first aid is to save the life, especially in case of poisoning. Different kinds of injuries need different kinds of first aid. In case of minor cut or wound, wash your hand thoroughly before giving first aid to the injured person. Then remove all the dirt from the wound and clean the skin around it with small pads of cotton soaked in an antiseptic solution. Then you have to cover the wound with a clean cotton dressing to stop bleeding. Tie a bandage. Make sure that the bandage is not very tight. In deep cut or wound, a deep cut bleeds heavily. It is important to stop the bleeding. So, you have to first wash the wound with the soap and plenty of water. Then, take some cotton or make a thick pad of sterile gauze and press it over the wound. Then, tie it tightly with a bandage. If bleeding does not stop, then you use a bandage called tourniquet. It is a white strip of cloth band which is tightly wrapped around the wound 2 or 3 times and then knotted. Raise the bleeding part with a tourniquet higher than the rest of the body. A deep wound must be shown to a doctor. The doctor has to stitch the wound, if it is very deep, to close it. When the skin is cut, germs enter the body through the injury and cause the dangerous disease called tetanus. The doctor gives an anti-tetanus injection to the injured person to protect him or her from tetanus. During summer, bleeding from the nose is a very common problem with children. Follow the steps to give the first aid in case of nose bleeding. Pinch the nose from 7 to 8 minutes and lean slightly forward till the bleeding stops. Provide the patient an ice pack or wet cloth to keep on her nose. An ice pack is made by tying ice cubes in a clean handkerchief. Ask the patient to breathe through his mouth. Also, do not allow him to blow his nose. For heavy bleeding, consult the doctor immediately. When a person falls down and gets hurt, his bones may get broken or cracked. This is called a fracture. You know that it is a fracture when the part of the victim body that is hurt is in the great pain and the victim is unable to move the broken limbs. There is a swelling around the area that is hurt. You cannot treat a fracture on your own. The only first aid you can give is to ensure that the fractured part is not moved anymore. Follow these steps for first aid in case of a fracture. Keep the patient calm and comfortable and call the doctor immediately. Take a magazine, piece of cardboard or wood or a pillow and tie it around the fractured part. This acts as a splint and prevent movement of the broken bones. When a bone of the hand is broken, make a sling using a cloth or a bandage and support the arm on it. The sling gives support and prevents movement. When a bone in the leg is broken, tie a splint around the fractured leg. Do not allow the patient to move his leg at all. When a patient has to be moved, he should be carried on a stretcher. Get an X-ray of the fractured part immediately. Sometimes joints such as the ankle or the wrist get twisted. The tissues around the twisted joint get damaged. The joint swells up and is very painful. For the first aid of sprain, use a cold ice pack. Rub an ointment lightly, then relieves pain on the sprained joint. A crepe bandage should be wrapped around the sprained joint to support the joint. A sprained joint should not be moved so that it heals faster. One gets burnt with hot objects such as fire, boiling water, or hot milk, crackers, and chemicals. Burns are very painful. They are of three types: minor, severe, and chemical burns. In case of minor burns, the skin turns red and there is a burning sensation on the affected area. You have to keep the burnt area under the cold running water for a few minutes. Then apply ice cubes on the burnt area. Cooling the burn gives relief from pain. Apply a cream for burns on the burnt part. This gives relief from the burning sensation. In case of severe burns, take the patient to the doctor immediately. Severe burns need special care. Sometimes blisters are formed in the burnt part. They should not be pricked. An open blister becomes an open wound through which germs enter the body and cause infection. Cover the burnt area with a clean piece of cloth to protect it from germs and also from dust particles and insects. When a burn is caused by a chemical, wash the affected area with plenty of water to remove the chemical. Then give first aid as for the other burns. A fire is often very destructive. It causes loss of life and property. Fire spreads very fast. Hence, it is important to control it quickly. We control all kinds of fires by reducing the temperature of the burning substances. cutting off the air supply. Now we will discuss about firefighting. When paper or wood is on fire, it is extinguished by throwing water over it. This reduces the temperature of the burning substances. When a fire has been caused by petrol, it is extinguished by throwing sand or mud over it. This cuts off the air supply to the fire. Never throw water over burning petrol or kerosene. When the fire is caused due to an electric short circuit, it can be extinguished by throwing sand or mud over it. Switch off the main supply immediately to prevent the spread of fire. Throwing water over such a fire can be dangerous. When this flowing water touches someone, he or she can get an electric shock. Fires are also extinguished by some special devices called fire extinguisher. We must learn to use them. They should be used instead of water and sand for extinguishing fires. If a person's cloth catch fire, throw water on him. Ask him to roll on the ground. Cover him with a blanket or an overcoat. This cuts off the air supply and the fire gets extinguished. In case of big fires, we should not shout for the help immediately and dial 101 on our telephone to call the fire brigade. It is important to remain calm over the telephone and give the correct address and important landmarks of the place on fire. The saliva of animals like dogs, cats, monkeys and voles contain virus of a very dangerous disease called rabies. When these animals bite someone, the virus enters the victim's body through the animal's saliva. This causes rabies. It is very important to treat animal bites immediately. We have to follow some steps. Wash the wound well with soap and water to wash away germs contained in the saliva. Take the victim to the doctor immediately. The doctor gives anti-rabies injection. When a poisonous snake such as cobra or a crate bites someone, the poison spread through the blood. In case of snake bite, you have to follow some steps again. Make the victim lie still. This is because movement causes the poison to spread faster in the victim's body. Apply a tight bandage just above the bite to stop the flow of blood to the heart. Take the victim to the doctor. The doctor gives an antivenom injection. To avoid accidents, we must be more careful. We must learn and practice first aid to be used during an emergency.